Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Hello. We currently have medications for just about every chronic disease known to man so far. Heart disease, diabetes, cancer, strokes, arthritis, you name it, there's probably a medication out there for it. But what if I were to tell you that aside from medications, there was lifestyle changes and lifestyle measures that you could implement to help to prevent and treat chronic diseases, sometimes just as well as medications, or even better, believe it or not? Well, it's true. And today we're going to discuss these points and we're going to answer some of your questions here on this episode of Ask the Doc. Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions and I answer them. I'm Dr. Kamaljeet Kaur, and I'm a board-certified primary care physician here in Coral Springs. And I'm going to be talking to you today about lifestyle changes and lifestyle measures, basically a healthy lifestyle and habits that can help to prevent and treat disease. Our first question, we're going to jump right in, comes to us from Juliana. And Juliana asks, Dr. Kaur, what can I do to help my spouse lower his cholesterol and his A1C? Juliana, thank you for reaching out and asking us this question. You know, I get this question a lot for very many reasons. And unfortunately, high cholesterol and sugar problems or diabetes, prediabetes, insulin insensitivity, insulin resistance, whatever name you want to give it, they're running rampant through our society right now. Some great information. Now let's get back to Juliana's question. But first, let me just explain. Cholesterol, as the video beautifully explained, is something that we're all familiar with. But Juliana also asked about her spouse's hemoglobin A1C or HA1C or just A1C. This, for those of you who don't know, is a protein that we use to monitor and diagnose diabetes or insulin resistance. Now, this protein basically gives us an idea of how your glucose and insulin are interacting with each other in your body, good or bad, high or low. When this value is elevated, you can be diagnosed with prediabetes or with diabetes itself. And according to major medical societies and the research that we have, there are many ways to lower the A1C and the cholesterol. But the first and foremost is always your lifestyle and healthy habits. Incorporating those healthy habits is really going to help to improve the way your body metabolizes the cholesterol, the good and the bad cholesterol, and how your insulin and glucose react with each other. I could go on and on about that all day, but that's pretty much the gist. And I always tell my patients, medications, if we recommend them to you, which we do very, very we don't take it lightly when we recommend medications, but if we do, those are meant to be the icing on the cake. The cake is supposed to be your lifestyle, your exercise habits, your nutrition habits, your healthy habits. So I always say, take that into consideration when you're trying to lower these conditions and to manage them. Now, the healthy lifestyle habits that we're going to talk about and that, are the most important is first the diet. So a healthy, nutritious, whole foods, plant-based diet, minimizing meat in general, definitely red meat, but minimizing anything that's processed or packaged, made in a factory, anything that Mother Earth didn't make really. And then exercise, engaging in physical activity, not just physical activity, but moderate to rigorous physical activity. And that should be done for at least 30 minutes a day, at least 5 days a week. So you want to get at least 150 minutes in a week of physical activity to really get everything pumping and at its best. Now, these items, they all work in various manners to really optimize pathways in your body to optimize your health, reduce your risk of disease, and treat the diseases that you have. As important as diet and exercise are, we can't forget the importance of stress reduction, getting at least 7 hours of sleep every night, and really maintaining good and fulfilling social connections with your loved ones. It's very, very critical to your health, whether it's going to be good or bad. Those lifestyle habits are only going to improve it. Now, our next question comes to us from Jackson, and Jackson reached out to us through YouTube. Jackson asks, Hi, Dr. Kaur. My pops was just diagnosed with heart disease. They're going to put him on medication, but they also want him to exercise. If I'm being honest, the only physical activity he's had lately is walking from the fridge to the sofa. What kind of stuff should I have him do? Jackson, thank you so much for reaching out. You're such a wonderful son that you care and you're asking these questions for your dad to help him. That's just really heartwarming. But let me start, Jackson, by telling you this, that when we're incorporating physical exercise and activity into our daily routine, whereas it wasn't there before at all, we should really, really start slow because otherwise, there's going to be a risk of injury and of falls, things that we really don't want to make the situation worse or to make one's health worse. I know a lot of times people just want to jump in and go from 0 to 100, but that's probably one of the worst things that you can do because you really want to get your body up to a certain level of endurance so you can continue to increase and build muscle, build your cardiovascular health, all that good stuff. So, that being said, encourage your father to start out slow, depending on any other underlying health conditions that he may have. So, for instance, if he has chronic knee pain or back issues, there's certain exercises that his physician may recommend that he avoid. So you always want to take into account what your current health status is and tailor your exercise regimen to that so you're not injuring yourself or putting yourself at risk for any other health issues. Now, a person's health activities can be tailored by their physician, their primary care physician, by a personal trainer who works closely with their physician. So there's many resources that you can use, but the point of the matter is it should be personalized to him. Now, if your father has been sedentary, then it's not going to be likely that he's going to start running a triathlon tomorrow, right? So start slow. Encourage him to do maybe even 10 minutes of walking daily. I know it doesn't sound like much, but believe it or not, even 10 minutes of walking has great health benefits. So once he gets that into his regimen and his daily routine, it's going to become a habit for him, a healthy habit. And once that becomes a habit, he can then increase it. So, next week he can do 15 minutes and then 20 minutes and slowly increase up to that recommended 30 minutes a day. Now, the other thing that's also important, in addition to walking and physical aerobic activity, is strength training and weight training exercises. Did you know that lean muscle enhances your glucose and insulin metabolism, as well as cholesterol metabolism, and helps with weight loss? Lean muscle is so important, and we unfortunately start to lose it slowly over the age of 30. So even if you do nothing, you're going to lose muscle, especially the older that you get. So that's why we really have to combat that by incorporating strength training into our lifestyle. Also, it helps with walking, balance, confidence, and avoiding, injuries if you fall or you lose your balance. Now, doing repetitions of various types of weightlifting or weight training exercises, even with just 2 to 5 pound weights, is going to be helpful. There's no need for him to jump in and do a 200-pound bench press. No, that's not how we want to do it. Start slow and increase gradually as you can tolerate it. And then once you get to a certain point, you're also going to be more confident. And you might even find that exercising or working out is fun because it's going to allow you to be more active in life. And that's always a good thing, isn't it? So generally, increasing your physical activity and exercise regimen should be done slowly, and it can actually take 4 to 6 weeks to build to an optimal level of endurance. So please don't expect this to be an overnight process. Now, we have somewhat of a probing question from Tom, and Tom asks us, "Hello, Dr. Kaur. Can you stimulate the prostate using your sphincter muscles?" This is a great question. You know why? Because we often talk about pelvic floor muscle strengthening when it comes to women's health and gynecological health, but it's really important for men as well. Performing certain pelvic exercises helps to strengthen those muscles, the muscles that surround the prostate and that support the prostate and the bladder, and really maintain that prostate and bladder health in men. Now, these pelvic floor muscles include sphincters, which are located in various parts around the prostate gland, and these support bladder health and they support the flow of urine as well. So it's important for these to be strong. And it's especially important for men who have symptoms of an enlarged prostate because it can help alleviate difficulty urinating, dribbling, or incomplete urination, urinary leakage, or even incontinence. So very, very important. Some of these exercises are Kegel exercises and anal sphincter exercises. You could do them a couple times a day for a couple seconds each. And over 4 to 6 weeks, you may start to notice an improvement in your symptoms. Now, these aren't meant to treat symptoms or to treat an enlarged prostate, but they can certainly help alleviate some of those symptoms. I do, however, suggest discussing with your physician first because he may have personalized recommendations for you based on your own prostate health. Thank you. That was a great question. This is exciting. We get all these questions that I feel are so useful for everybody to know, these health tips. They're just so, so important. Oh, and I especially love this next question, and it comes to us from Eva, who reached out from our very own website, allhealthtv.com. And Eva writes, "Hi, Dr. Kaur. I'm a pre-diabetic, middle-aged woman with a little love around the middle, high blood pressure, and a family history of cancer. I've talked to my primary doctor and my therapist, and they both mentioned something about the 6 pillars of healthy living. I wasn't really paying attention then, but I am now." Oh, Eva, this is a subject that I'm so passionate about. So I love discussing it. And it's never too late to reap the benefits of a healthier lifestyle. So, the 6 pillars that really maintain and are the foundation of a healthy lifestyle, let's get into it. Well, the nutrition part of it, I mean, I think I talk about this all the time, and my patients maybe get annoyed, and I understand that. But healthy diet, whole foods diet, plant based diet, the Mediterranean diet, these are all ways to maintain a healthy diet for your body. Regularly engaging in physical activity and exercise at least for 30 minutes a day, 5 days a week. Remember, do it to your tolerance. Don't overdo it. Slow and steady wins the race. Getting at least 7 hours of sleep nightly is the recommendation. And it's not just 7 hours, it's 7 restful hours, uninterrupted sleep. So if you're waking up a lot or you're not even getting the 7 hours, that can actually be detrimental to your health. Stress reduction, we talk about that all the time. Stress can have a lot of detrimental effects on your body, on your physical health, and your mental health. So you want to reduce your stress when you can. Avoiding risky substances like alcohol and cigarettes. Maintaining fulfilling connections with your loved ones. That's also very important. And Eva, I'm so passionate about these 6 pillars that I'm going to put them on screen because I think they're that important. And I really want you to read through them. I want everybody to read through them and make sure that they understand there's different ways of achieving these goals, but just to start is great. So keep those questions coming. And here we have another one from Glenn. And Glenn reached out to us through YouTube. And he asks, "Dr. Kaur, my husband is a stressaholic." Oh, I've met some of those. I've been one of those. "He worked in the financial sector and thrived in all that craziness. He's not a young man anymore and has been diagnosed with high blood pressure. I've been told that incorporating mindfulness and meditation into your daily routine can help relieve stress and anxiety. Sounds great, but what is mindfulness and where can we learn to meditate?" Oh, that's a terrific question, Glenn. Excuse me, Glenn. And I'm so glad that you asked because it's important to talk about. So, this reminds me of a patient that I had, and I want to share this story because I want to emphasize how important stress reduction and reducing anxiety is. The patient I had several years ago was a wonderful gentleman in his mid 50s, and he had a thriving business, but that also meant that he was under a lot of stress. And unfortunately, that led to some serious health complications, and he was forced to reduce his work and focus on his health. And I always say, make these changes before you're forced to make them. Adopt a healthier lifestyle before you're forced to do so, because sometimes there's no turning back. Now, mindfulness and meditation have been proven, yes, scientifically proven to reduce stress and indirectly reduce your risk of cardiovascular conditions and heart disease. Essentially, mindfulness, for those of you who aren't familiar with it, it's being aware and engaging in your present moment, not thinking about the future, not thinking about the past, not worrying about the future or the past, and really just focusing on what is in front of you today, where you're at in life today, and the things that you have to be grateful for today, because that really brings about feelings of calm and a sense of accomplishment and achievement. And it just feels good inside when you're not worrying about things, but just being appreciative of what you have. And that results in happiness. And that's a good thing. We all want to be happy, right? Now, meditation, there are so many resources available online. There's apps, there's so many ways to learn how to meditate. And I think the one thing that I want to emphasize is about meditation is that it's a process. I'm not going to say that I am great at meditation, even though I think it's great. It's very difficult to do. It takes a few tries. I have failed many times because it is very difficult to just shut off your mind and think about the now and just kind of be. But I can tell you for sure that it is very beneficial and it's very worth it. So it might take a few sessions, and even if it's just a few minutes a day, I highly encourage meditation. It has been proven to do so much good in your body that I won't get into detail, but just trust me on that. Now, the next question comes to us from our Instagram viewer, and this is from Lakshmi. Hi, Dr. Kaur. I'm a 60-year-old widow and I live by myself. My husband and I had just moved to Florida when he suddenly passed away. I'm so sorry to hear that, Lakshmi. My kids live across the country and I don't really know anybody here. I guess what I'm trying to say is that I'm lonely, which I think is having an effect on my health. Is that even possible? My heart certainly goes out to you, Lakshmi. I know how difficult that transition can be, and that's such a great loss, and how negatively impactful that can be on your life. So I'm very sorry that you're going through this, but I'm glad that you wrote in for the question, because you're 100% right. Having those feelings of loneliness can certainly negatively impact your health. But you said 60, that's the new 45. So there's no need to worry. There's ways to help, to get help, and we really encourage you to do so. I want to talk a little bit about loneliness. Unfortunately, in the last several years, we've definitely had a rise in loneliness across the country, across the world with the pandemic. Absolutely. And even though we have more ways of being connected nowadays, and we have FaceTime, you have cell phones, you have video chatting, there's so many ways to connect with your loved ones and with other people, but that doesn't necessarily mean that you're building those fulfilling, deep relationships. And honestly, even though we have all those ways to connect, we've never been lonelier as a society. And we are seeing the negative impacts of that on our health statistics and in our patients. There is a greater risk of certain health conditions if somebody is lonely for a prolonged period of time, especially in the elderly population. We see that there's an increased risk of dementia, of depression, even premature death can be caused by long-term feelings of loneliness. Now, needless to say, it's a serious, serious health condition. And even though, you may be surrounded by people, or somebody might be surrounded by people, doesn't necessarily mean that they're immune to feeling lonely, because they may not be feeling those deep emotional connections. Your circumstances, Lakshmi, I'm all too familiar with those. In fact, it's something that my mom went through when I lost my dad and she lost her husband. It's very, very natural to grieve and to feel lonely after a spouse passes away. I know for my mom, she found relief in religious groups, made friends through there, and now we hardly see her because she has such an active social calendar. I live 2 minutes from her, but I probably see her once a month, it's perfect. I hope that you're able to find a solution, and I hope that you're able to connect with others so that you can get through this time. It's very, very important to take the feelings that you have and to share them with others so you can heal and so you can grieve and move on, to say in simple terms. There are many online resources too. There's a lot of national organizations that have the goal of helping seniors, or really anybody who's feeling lonely with, they have clubs and other resources. I really, really hope that you can look into those. Maybe consider moving back to where you have family and friends. Those social connections are so important, and they're part of a healthy lifestyle. I wish you the best, and I wish you peace and strength, and I hope you get back to your fighting self soon. Now, we have another question from our website, allhealthtv.com. And in case I haven't already mentioned it, you guys should really check out the website. There's a lot of great information on it, a lot of tips and tricks for a healthy lifestyle. So let's see, this next question comes from Jay. And Jay asks, hi, Dr. Kaur. I broke my ankle about 6 months back and I had to have surgery. Oh, I'm sorry. Which kept me off my feet for a while. As a result, I put on a couple of pounds. Okay, maybe more than a couple of pounds. which surprised me because I'm only 32, I'm athletic, and I've never had to worry about weight before. My question is this. I'm someone who has ADHD and I often struggle with consistency. How can I incorporate healthier habits and get myself back on track? That's a very great question, Jay. And thank you for reaching out. I'm so glad that you're advocating for yourself because that is so, so, so important. So, as you may know, Jay, establishing a structured, consistent daily routine is very, very important. Excuse me, guys. Sorry about that. Now, establishing a consistent and structured daily routine is very, very important to managing ADHD, and having a plan and maintaining that organization also provides a sense of self-calm and can help you reach the goals that you want to reach, even for those who don't have ADHD. So that's an important tip all around. Now, I'd suggest starting off with a simple routine. The more complex it is, the more difficult it is for your brain or anybody's brain to adapt to it. So you want to start slow and steady. Now, that 10-minute walk that I mentioned earlier, that's very important. So maybe just start your day with a 10-minute walk. And as your brain gets used to it, and as you incorporate that and make it a healthy habit, you can increase to 15 minutes, 20 minutes, and then even add on other activities to it. But the point is, start slow, start steady, and start with a regimen every day. Same time, this is what I'm doing. That's my plan. Now, once you have that daily routine set, then it becomes a habit, a healthy habit, and then it's not going to be so difficult to maintain. I hope that you're back to 100% soon. Now, we got another question from Jalen, and Jalen reaches out to us from Facebook. Jalen asks, hi, Dr. Kaur, I'm 25 and I've never had this problem before. And no, it's not the one that you might think it is. I haven't been sleeping well lately and it's having a negative effect on my life. It's hard to focus. My girlfriend says I've been moody and I feel jittery a lot of the time. My question is this: what are the long-term effects of poor sleep and what can I do to turn things around? Jalen, thanks for your question. It's an excellent question and it is such an important part of a healthy lifestyle to get good sleep. So as you can see, sleep has an important effect on our health, and not getting enough sleep can be really, really bad for your health and increase the risk of a lot of chronic conditions, obesity, health, heart disease, your memory, your concentration, so much stuff. So try to get at least 7 to 9 hours of uninterrupted, restful sleep at least every day, honestly, even on the weekends. Now, that was a lot of great questions, and I love that you guys sent them in. I very much appreciate that you trust us to answer these questions for you, and I love to keep doing them. Now, that's all we have for today, and that's it for this episode of Ask the Doc. Thank you for watching, guys. We'll see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.